when we got started in 1999. The HIV epidemic was enormous, and treatment was not yet available on the continent of Africa. We went in and worked with the community folks to just assure them that we could actually keep their children alive. It started off in a 2-room trailer. We were actually building the first pediatric HIV center on the continent of Africa. And within a matter of about 5 years, we had 6 countries on the continent, which was by far the largest treatment program in the world. To be able to go back and to see these children who are now actually getting married, going to college, and pursuing careers where when they were born, there was even thought that they wouldn't even survive I don't know how one could not be passionate about doing something like that. My name is John Damonti. I just recently retired as president of the Bristol Myers Squibb Foundation and vice president of global corporate giving and patient assistance. I'm an MSW and very proud of it. My experience at Fordham was extremely beneficial. When I was doing my field placement, little did I know that I would be in a role that could think about not individuals, but populations. The jobs that I've had and the roles that kept me engaged for so many years has really been the opportunity to put together partnerships, to really start to focus on unmet need in the community. It was my thinking from what I learned at Fordham and what I learned along the way as a social worker, that the community cannot be separate from the health system. They have to be one and the same. How do you take down barriers in the community, build capacity in the community, and then put community health care together with health system health care to ensure that people, regardless of who they are or where they live, can benefit from medical innovation? That understanding 25 years ago became the platform for the Bristol Myers Squibb Foundation for everything we do. And again, it's going back to the whole concept of thinking about it from a social worker's mindset. 2020, the world changed, right? COVID. We got to go into these communities and start to educate communities about the importance of vaccination and then help them actually have access to that. It's everything we've been doing for 20 years. We overlaid our COVID response into all of the programming that we were currently doing anyway. So, and that was all because we had these relationships with these communities. People don't think about clinical trial diversity very much, but it is one of the biggest issues in the pharmaceutical industry, and every company has to deal with it. Why don't we think about training the next generation of clinical trialists? And not just clinical trialists who are diverse and look like the people that they're trying to recruit into these programs, but have been trained extensively on community engagement to actually meet the patient where they are. We were funded at $100 million to create this model over 5 years. You're improving the health system, but you're actually doing it through community engagement to get better health outcomes. I can't think of people who are better at community engagement than MSWs. You learn how you actually connect with people. It's incredible in someone's life to be able to say, you know what, I made this world a better place. In social work, whether it's, you could think about the numbers of people that you saw on a one-on-one basis or a group program or however you sat, that you left this world in a better place than when it came. And if you think about that as your career and what it meant to me to be employed by a company that allowed me to do that, nothing better. I would have to say that after 33 years at Bristol Myers Squibb, that if I was to leave this earth tomorrow, that I would leave knowing that I made this world a little bit better than when I got here.